How's everything? You now tuned into the Vibing with Don Vito show. I thank y'all for coming to my show. Today is Friday. Happy Friday. You know, the weather looks kind of rough, but it's still a good feeling, you know, to be healthy, be strong, you know, working and, you know, productive out here in the community. And just thank God it's Friday. But we have a guest coming on today, a special guest, something different what I normally do. Her name is Chris Norwood, and she's the executive director of the Health People Organization. So we're going to talk to her today, and we're going to talk about some interesting stuff. This is going to be an interesting show today, and I thank y'all for tuning in. I want y'all, you know, to give us some support and show us some love. And let's wait for Chris Norwood to come on, and then we just take it from there. Meanwhile, back at the ranch, if y'all want to get your fitness and health and fitness information, you want to get in shape, you know, you want to learn how to do certain things, you need like a consultation. I'm giving free consultations. You go to Vibing with Don Vito, or you can go to fitnesscoach_Big V. But right now, Miss Norwood just pulled up, so we're going to talk to her, and we're going to have a great interview. Hello.
Hey.
How you doing?
How are you?
I'm good. I need to see your face.
Okay.
You sound, oh, there she go. There she go. How are you?
Oh, I'm fine, Don Vito. Very good.
Good to meet you. I heard a lot of wonderful things about you and your organization.
Well, thank you. We appreciate that.
Yes. So can you introduce yourself to the viewers right now?
Yes. I'm Chris Norwood. I'm Executive Director of Health People, which is a South Bronx organization that we train people from the community to keep other people well if they have AIDS, diabetes, asthma, what they need to do to take care of themselves. And of course, now, tragically, we are working on COVID and COVID prevention.
You know, it is very important stuff that you're doing right now. Well, it's been important for a long time, but right now, it's super important. Super important.
Well, you're absolutely right. And some people don't realize that because they think, you know, like COVID is separate, I'll keep away from that. But there's been, you know, higher rates and poor outcomes among people who do have other chronic diseases, especially diabetes and high blood pressure. So the more you can do if you have a chronic disease to keep that in good control, to bring down your blood pressure, to bring down your blood sugar, if you do tragically get COVID, your outcome will be better. Your chances of not getting really, really sick or, you know, dying, they will go down if you keep those other diseases in the best control you can.
Yes, and like when COVID first hit, we can't really say when it exactly first hit, but when we all found out about it, say like February, March, somewhere around there, a lot of people just died in waves. And what I heard, you know, and I want you to get in on this in a second, most of these people already have physical ailments, and it just took them out.
Yeah, it was tragic. It was tragic. So now we know. And we really have to let other people know. I think some people feel they're just a target and there's nothing they can do. But really, if they have those other ailments, if they work on their self-care, work with their doctor, they'll be so much better off. We hope they don't get COVID. I'm really happy to tell you, which is part of what we're looking at now, you know, the Bronx had the worst infection rate in the city. It was about up to 30% of people who were tested for COVID.
Wow.
Now it's down below 2%, which shows what people can do. And people in the Bronx have done that, you know, by wearing their masks, by not hugging each other as much as they want to. Using their elbows.
Yeah.
Think how rude it used to be considered if you elbowed somebody. And now it's the polite thing to do. And also, we in the Bronx, you know, I should tell you, it's the birthplace of hip hop. So we count on our youth to really lead us and help us. And what we're going to tell your audience about today, and I know you know about it, is we're having a contest where young people from age 5, that's young, to 24, they can submit any kind of message they want. It could be rap, it could be poetry, it could be a picture about being aware of COVID, doing the prevention, wearing your mask, and also, as we should, we have prizes for them. The first prize is actually $250, and we have 10 prizes. They're not all $250, but and we're going to have, like a nice ceremony, which I really hope you will come to when we have the winners.
Okay. When's the date and the location?
The entries have to be in by November 23rd. And to get more information, they can email Letitia Gibbs, LATISHAGIBBS @healthpeople.org. And she'll send them all the information about how to do entries, when you have to do it by, and maybe we have this wonderful flyer. I guess we could send it to you later, to put up, or if you can do that, that would be wonderful.
No, I think I have it. So,
oh, good.
Gio sent it to me already.
Letitia's that way.
Yeah, I'm gonna put it on. I have a marketing page. I'm gonna put it on that, and I'm gonna spread it around for you.
Oh, that is great. And by the way, I want to congratulate you on your Harlem honors. I saw the video. Letitia sent it to me, and that was very impressive. Congratulations to you.
Thank you very much. We do our best. Well, I definitely do my best, all the time to try to give back to the community.
Well,
stuff like that.
We need that. And as I say, when you see what the Bronx has done to bring down its COVID infection rate, and they hardly advertise that.
Right.
I mean, it's very good for people to know that all of this, you get up in the morning and you're saying, oh my God, do I have to put my mask on again today? You do all this. It's very important to know that it's having a huge impact, that it's protecting your family and community.
Yes. And like when COVID first hit, I think that so many people got sick, or a lot of people passed away because we didn't know what to do. We didn't know what to do.
No. And when people saw that, maybe they thought there was nothing they could do. But now we've proven that you can.
It does work. It does.
Yeah, it works.
Washing your hands, something we were raised to do when we were kids. Wash your hands.
Right, back to basics.
Back to the basics, right? So how long have you been in the profession that you're in now?
Well, I'm going to tell you, but don't tell anyone else, okay? 25 years.
Oh, congratulations.
Thank you.
Yes.
Originally, we started as a women's AIDS peer program. And it's also, AIDS was very painful. It's still painful. But when you look at that, that was an infectious disease. And really, by the community learning, doing prevention, that has been brought way down too. You don't see the number of people dying now. And of course, there are medications for AIDS, which are much improved. But people have to go to the doctor. They have to take them. And so we started that originally as a women's AIDS program because women weren't receiving much attention. And back then, if women had AIDS, they only had on average a year to live. Now you can live almost a full life.
Right.
And when I saw that women who had that terrible death sentence hanging over their head, they said, I'm going to spend what's left of my life getting out in the community and helping other people, helping them understand prevention, and, how to not get this. That's what we call peer education, the peers going out to the community. And I said, boy, that's the way we should do everything.
Yes. So let me ask you a question. So what is your advice to people who want to, with the high blood pressure, the diabetes, all of these other things that can be helpful to them?
My advice is, if possible, we don't have enough, take a self-care course where you go for your medical care, or, really learn yourself. If you can't get a self-care course, go online and learn as much as you can about how to care for yourself.
Right.
And then also, of course, work with your doctor to, high blood pressure and diabetes, they involve different medications. But in many respects, the self-care is almost the same. It's improving your diet, getting some exercise, really having less salt and sugar.
Mm-hmm.
A good thing for everyone in the United States to do would be to read the label of everything they eat, because they will be in a state of shock.
Right.
Even salad dressing is, people get a salad, they say, I'm changing my life, I'm eating a salad. And then they have to look at the salad dressing. It's very sad, because a lot of commercial salad dressing, the first ingredient is sugar water in the salad dressing.
Mm-hmm.
So that would be, my advice now. We have Google today.
Right.
You can get a lot of real information.
A lot of good information.
Uh-huh.
So I'm a health and fitness coach also.
Oh, terrific. So you know all this already. You're just leading me on.
Yeah.
Oh, okay.
I've been a master trainer for 20 years.
Wow.
Yes.
That is great.
Yes. If you ever need my help to do some volunteer work, or to come speak to some kids, anything about health, anything fitness-wise, I'm your man.
Okay.
I'll be happy to do it.
I know where you are.
Yeah. You won't have. It's not hard to find me. I love, giving back and sharing knowledge and information with people. That's going to help, especially the youth, because a lot of people forgot about our youth.
Yes, and I think what we found is that whether it's kids or grown-ups or grandparents, once they have the information, then they start acting on the information.
Yes.
Like, who would think to look at salad dressing? What's in salad dressing?
Mm-hmm.
You don't really think about that.
Yes. You're right. You think because you're eating a salad, you supposed to be 100% healthy, but the stuff that you put in the salad what makes the salad unhealthy.
Yeah.
If you don't read the label.
Yeah.
Yeah.
It's a real education to just start reading labels.
Yes. So, Ms. Norwood, where you from, the Bronx?
I'm not from the Bronx. I'm from the Upper West Side.
Oh,
the Lower Bronx.
Oh, Upper West Side. Upper West Side. That's where I did all my training, Upper West Side, in 94 for Broadway. Yeah.
Woo. That's right near me.
Uh-huh. That's where I'm from. So how was life growing up as a young girl for you? How did you grow into the person that you are?
Something, and I hate to put things this way because I like to see people happy and, but sometimes tragedy does make you grow.
Mm-hmm.
And so I think that's how I the most changed, by facing, several tragedies, including starting to deal with the AIDS epidemic and realizing, on the one hand, how much people could do, on the other hand, how little they really got help to do what they could do.
Right. So that made you went into like the medical field, or what happened?
No, Again, I don't want to put it this way. I think I learned to do what I do because I knew nothing.
Okay.
I knew nothing about it. It was just accidental. I was a journalist. I did some health writing, but, not that much.
Mm-hmm.
And I happened to write a very early article on women and AIDS. And then I said to myself, wow, this is really, really, and people don't understand it. And looking at myself, I said, like, I never had to go through a war or depression. I guess we're going through wars and depressions now, but I never had to do that. I
Right.
mean, so many people in history had to go through so many horrible things. So everyone kept saying, then we'll have a cure for AIDS in 3 or 4 years. So I said, well, I could just go try and do what I can for 3 or 4 years. I mean,
Right.
what is that compared to everything that's happened in history?
Mm-hmm. So let me ask you a question. So 2020 has been a real tragic year for a lot of people. So
Terrible.
let's talk about COVID-19.
Okay.
Yes. How did it affect your life, or did it affect people around you? Stuff like that?
Well, it really, really affected the life of everyone here. I mean, Letitia had 3 family members with COVID. We had 6 staff, but you had to, especially with the rate so high in the Bronx. But I think everyone in the city in the beginning was worried. Anybody could get this. Anybody could die. But when you look at communities where the rate was so high, it's great it's gone down, but it's left behind this huge trauma, not only the deaths, but the sense that, okay, so why does everybody still have all these chronic conditions, and that wasn't addressed before? We could also see the national problems. There weren't enough masks. There still isn't enough testing. I mean, we're part of the city test and trace, but nationally, they're not distributing enough tests for everybody today. And it really has left people, very sad with the relatives and friends they lost, but also with, painful realizations of what needs to be done and what hasn't been done.
All right. So we have a very important election coming up in like a couple of weeks. Let's talk about that.
Okay.
So how do you feel? How do you feel about the state of the government right now and stuff like that?
What I feel is that, and we can mainly blame it on one person, but not entirely, the whole way that public life is presented has become so toxic that it's affected almost everyone in the country.
Right.
What I hope is after this election, these sort of horrible tirades, but also some things the other side does. I'm very upset now, frankly, with the Democrats because they won't pass even a smaller COVID relief bill. And people are very dependent on the COVID relief financing.
Yes. Oh, yes, yes.
So I don't know how, but I think we all, whatever our, particular political, we are all going to have to work to be kinder and more supportive to each other and bring back, some sense of civic life and building together. And that's what's been destroyed in the United States.
Yes, yes. And the way I don't see it happening anytime soon.
Yeah, it's going to be a huge challenge. Even when someone goes away, it's still going to be a huge challenge because it's just left behind, like COVID is left behind literally millions of people in trauma, not because they had it, but because their community was so badly struck. And then we have this trauma in our public and political life.
Let me ask you a question. It's like anytime a person sneezes or coughs and stuff like that, first thing a person will say, "Oh, get away from me. You have COVID." How do you feel about that?
Well, I think most people cough every day. So they do. And, a few coughs, a few sneezes, that's not really COVID. But that's another good reason to wear your mask because you don't want to make the people near you nervous and paranoid. I had a strange situation on the bus this morning. I sat down, I had my mask on. I didn't sit next to someone, I sat behind them.
Mm-hmm.
And this one just turned around and looked at me like I was some kind of monster. I guess she didn't even, but, she got up and stalked off. And
Yeah.
I said, boy, really amazing. And I was checking, did I forget my mask? So people
Not
get
funny,
very,
yeah.
very nervous. And, that's why it's good to try and do these things in public places, because a certain number of people are just going to be nervous all the time.
Yeah.
And here we are.
Yeah, I had that incident the other day where I live at. I was getting on the elevator. And
Uh-huh.
it was this lady. She was an older lady, so I understand how she probably felt. She's like, please don't get on. Please go on. No offense, but please, can I ride by myself? I said, sure. It's okay. I
Yeah.
understand. Because some people, don't know where their mind state is at with that,
Uh-huh.
And she was,
I mean,
she was terrified.
there's one woman in my hallway. We're only allowed to have one person in the elevator. But I've known her for 20 years. She runs from her door to the elevator, right? And if I'm coming later, I stand back. If I just say hello, no, run. But that's the way people feel, and you have to,
Yeah.
try and allow for that.
Yes. So another thing that I wanted to touch on was like, ever since COVID, no one pays attention to AIDS like they used to. They don't pay attention to high blood pressure like they used to. They don't pay attention to obesity, all the other things that's been out there way before COVID-19.
Exactly.
Yeah.
And which have made COVID worse. So we're working especially because we have a group of the most outstanding diabetes peer educators. Sometime when you want to look at health, we have people who've lost 100 pounds. We have people who've reversed their diabetes. They had diabetes and they did so well. Their doctors have taken them off medication. And that might be, again, we don't tell people the good news and what's possible. And these are, one of the ones who lost 100 pounds, and this is so common, when the doctor first told her she had diabetes, she gained about 40 pounds because it made her so depressed and anxious that she kept going on these crash diets. And then that doesn't work. And then you get more depressed and you eat more. And now she learned how to do it step by step, and she's lost 100 pounds. She brought her blood sugar A1C level from 14 to 6.5. And if people have the support and education, they can do that. But again, we haven't told them they can do that. We just keep telling them, oh, everyone's getting fatter. Too bad they'll all get diabetes. Well, that isn't the way to do public health.
Right. Yes. Information, like you said, we have Google. So there's a lot of things that you can read up on, that's very helpful. If you have one of those, health issues, so to speak. So let me ask you a question real quick. How do you feel about Black Lives Matter movement going on all over the world?
I think the Black Lives Matter movement is fundamentally so important. Working in the South Bronx, I've seen, what's called structural racism. And I'm very well aware under Mayor Bloomberg. It's interesting to look at. Under Mayor Giuliani in the early 90s, when, there was incredible crime, his stop and frisk policy was at 90,000 stops a year for the whole city.
Wow.
Bloomberg was he was going on 900,000 a year.
Wow.
Wow. And it's like you couldn't, we would have our staff, our board members, everybody would be stopped all the time. And I think a lot of the reaction is to, like, people especially men, they couldn't go out of the house.
Mm-hmm.
They'd be stopped. But once we get through this phase, I would like to humbly suggest that Black Lives Matters needs to analyze more the structure of public programs.
Mm-hmm.
I will say this, New York State spends more on health for Medicaid recipients than any other state in the nation, and yet everybody's sick. So what is that about?
Wow.
You know, that kind of analysis, because they aren't using that money to do the kind of prevention and the education we talked about, you know.
Yeah.
One of the things I would like to see a movement to defund dialysis centers. All those dialysis centers on every corner, and the majority of people, if they had the education early on with both high blood pressure and diabetes, they would never have ended up on dialysis. That costs $90,000 a year for each dialysis patient, but the state won't pay like $900 for a real education course for people when they're in early high blood pressure or early diabetes, which would prevent them from ever getting to diabetes. So that's what I mean by, once we get through this phase, let's analyze some other things and how they really work.
What ratio of people do you have coming into your establishment more so, like African Americans, Latinos, Caucasians, Asians? Who's more high risk?
Yeah, well, where we're located, it's mainly African Americans and Latinos, and maybe 5% Caucasian.
Yeah. So you would recommend more exercise, diet, stuff like that?
Exercise, diet. One thing that's very exciting that's happening is what's called plant-based nutrition. You probably know this. Are you leading me on again?
I want to hear it coming from a professional. I love to hear, I love to talk about health, It's important. It's very important.
Now, when you first say this to people, as you know, with plant-based nutrition, you don't have to only eat plants, but you have to bring down your meat and your fat and so forth. They've done studies, really, where they've taken people with diabetes, they take them to, some nice center, some nice country place, put them there for 30 days, put them on this diet. They have 100% reversal of diabetes. All right. Now, that's not the real world, but it really shows you what. And right now, the results aren't in yet. But at Bellevue Hospital, they're having the first demonstration of plant-based nutrition for public hospital patients, and especially teaching those with diabetes and high blood pressure. Borough President Eric Adams is very much a force behind this. He reversed his own diabetes and got back his eyesight, actually, or he lost his sight in one eye, by studying plant-based nutrition himself and putting himself on appropriate. And then he then convinced his 80-year-old mother to change her diet, which I'm sure you could imagine was the challenge. But she did so. She was off injected insulin in 2 months. And this is another thing we have to let communities know about. I mean, this is so hopeful that you can make changes. And as I say, we advocate making changes, but we're not trying to, harangue people or get out there, do this, Here's the information. Just start using it. Letitia just told me a story. Someone told her she was at the gym and she was drinking her Pepsi Cola. She drank a liter of Pepsi Cola every day. And some guy started talking to her about Pepsi Cola. And she said, "You're not getting that away from me." He said, "All right, I'm not trying to. All I'm suggesting is that for one day, you drink water instead of Pepsi Cola." Okay, one day. And she did that. And even in one day, when she went back the next day, the Pepsi tasted awful. So it's like learning,
Yeah.
learning. We have people like Letitia was. They come into our classes and the first thing they say is, "You're not getting my Coke or Pepsi away from me." And we say, "We're not even trying.
Yeah.
Here's what you can do. Try this, try that, see how you feel about it."
Mm-hmm.
And then maybe 3 or 4 weeks later, they say, "All right, okay, I don't want it anymore." And that's what you have to do. You have to be supportive, give people
Yes.
information. We have our classes in groups so they can brainstorm together.
Mm-hmm.
And the other thing is it's not easy to find fresh food. It's wonderful that you have exercise programs, exercise. So in the classes, people can kind of brainstorm together. What store may have some good fresh vegetables where you can get this? They form walking clubs.
Mm-hmm. So if people want to learn more information about you and what you guys do, how do they find you?
Well, our website is healthpeople, one word, .org.
Okay. And everything is on the website.
Everything's on the website.
Okay, that's good.
But I have to honestly say, at this time they can call and let us. But like other people, we had to suspend a lot of things. We're getting back to it now, but we couldn't have. We obviously could not have these in-person classes for
Yes.
months, and we're looking now about how to get back. But they can get the information on the website, and we will, re-get things started.
Yes. Okay, I want to thank you for coming to the show.
Oh, this was really fun.
Yeah,
Thank
it was
you.
great. You were easy to work with. You're
It's
natural.
nice that we discuss serious subjects in an optimistic way. I appreciate it.
Yes, and I think I need to come see you and we can talk about some more stuff dealing with health, fitness, exercise, and stuff like that. So I'll be paying you a visit real soon. I'll have you guys information and stuff like that.
Okay, that would be great. Thank you.
Yes. So you have a wonderful weekend. You tell
Okay,
Lucretia I say hello. Have a
you
wonderful
right here.
weekend. Hey, hello. How are you? Good to see you. And thank you for coming to the show very much. Thank you very much.
Thank you.
You have a good day.
Okay.
I'll talk to you soon.
Okay.
Okay, bye-bye.